the interest of social distancing, all participants in the VOA town hall joined from remote locations. As leaders warned of a global recession and populations are put on lockdown, experts insist that people need to drastically change their lives. Farley is an expert in infectious diseases.
You need the public to recognize and realize that while you are at lower risk when you are below 60, with each decade lower risk, people with comorbidities and underlying conditions, immunosuppressed patients for any reason, are at increased risk of complications from this infection.
In an era when the public is sometimes receiving mixed messages about the seriousness of the disease, it's time for governments to regain public trust, says Dr. Kamiar Alaei from the Institute of International Health.
And definitely, if we don't have a public engagement, and especially, the community are not engaged, we can't control disease. How we can bring back the trust of people and make it more important. I think the only way is to do more education and give more transparent results and show that there's not only a particular part of population who are more vulnerable and everybody may be.
Medical experts say the incubation period for this virus is from 2 to 14 days, which complicates things. Dr. Ingrid Katz from Harvard Global Health Institute says it's one of the biggest challenges countries around the world face, making social distancing key.
That's one of the biggest challenges we face. SARS and Ebola are other massive outbreaks that have been discussed in this context. And I think the difference there is that they were both highly symptomatic very early on. Whereas with COVID, it seems to be clear that there is a period after infectivity where people may have no or low levels of symptoms and absolutely still could transmit the virus. And so
that, she says, is a huge issue in terms of containment. Mariama Diallo, VOA News, Washington.